Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today.
So if it's medically necessary for the baby to be supplemented, the first choice, according to the American Academy of Pediatrics, is mother's own milk. If that isn't possible or it's not available, hand expression or pumping should be initiated as soon as possible to protect and build maternal supply.
You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Paladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you.
Welcome back to the Tongue Tie Experts podcast. I'm your host, Lisa Paladino, certified nurse midwife and international board certified lactation consultant. And today we are diving into a topic that's near and dear to every lactation consultant's heart. What we wish all medical professionals knew about breastfeeding. Whether you're a pediatrician, an OBGYN, a dentist, a nurse, or any other healthcare professional who works with infants and mothers, this episode is for you. If you are a lactation professional, please let me know if you agree with my topics or if there are any other points you'd like to add. I'm sure I'm missing some of them. I could go on forever on this topic with all the experience I have over the years. Let's explore the key points that can truly make a difference in breastfeeding. Number one, breastfeeding is not always natural for every parent and baby. While breastfeeding is biologically normal, it doesn't always come naturally to every parent-baby pair. Many moms experience challenges from latch issues to milk supply concerns to pain. Pain is often the number one symptom, right? As an experienced lactation consultant, I feel that I want to emphasize that feeding support should be a part of routine care, not just for problem cases. If your patient tells you that she plans to breastfeed, you should be making a referral or a connection with a lactation consultant prenatally. More on that later. Medical professionals can help by normalizing the challenges of breastfeeding and encouraging parents to seek help early, certainly at the first sign of distress or symptoms. For example, no infant should be supplemented without a lactation consultant to guide the mom in ways to protect her supply and maximize breast milk production and transfer. So that's my first point, that breastfeeding is not always natural for every patient. I should have started out telling you that today we're going to talk about 8 points. Okay, so that was number 1. Number 2 is breastfeeding education should be a routine part of prenatal care. Now, we talked about prenatal education, but this is more about having routine education. So number 1 was more about prenatal support when there's problems. But here we're talking about teaching the family about breastfeeding routinely in your office visits, whether you're a pediatrician or an OBGYN or a midwife. We should be expanding the amount of time spent on prenatal education for breastfeeding. Many moms receive little to no breastfeeding education during their prenatal visits. Lactation consultants suggest that medical professionals, especially OBs and midwives, initiate conversations about breastfeeding early on. Plant those seeds. Discuss topics like the importance of breastfeeding, common challenges, and where to find support. And if you do not have the time or the bandwidth to do this, this should be a referral. So always think about, what can I do myself and what can I refer? Now, that's how I was trained as a midwife. You'd handle what you know how to handle, and you refer for what you don't have the bandwidth for, right? So same here. You want to set expectations for what breastfeeding is going to be in this prenatal education, whether it's education that you give yourself or education as classes or lactation consults that you set up during the prenatal period. This reduces anxiety and prepares parents for the reality of breastfeeding. Number 3, the first few hours and days are critical for breastfeeding success. We've all heard about skin to skin. Immediate skin to skin contact after birth is vital for stimulating breastfeeding behavior in newborns. When I worked at the hospital, working really hard on trying to get baby-friendly practices in place, this was my focus. For 8 years, skin to skin was my focus. It was like I still dream of it. It's so special. It's so important. It's time that's difficult to make up. No feeling bad here. We can't go back and fix things, but if we can have uninterrupted skin to skin, delaying unnecessary medical interventions, it can be life-changing. And it's quite an amazing experience in a lot of cases. So separating mother and baby or early formula supplementation when not needed interrupts this. And we want to also, in those first days, encourage medical professionals to monitor breastfeeding closely in the first 24 to 48 hours. Encourage hand expression and feeding support to ensure babies are getting colostrum. And if there's any question about latch or milk transfer, that colostrum is the perfect way to hand express and spoon feed or syringe feed or even finger feed to make sure that the baby is getting what they need. Did you know that in the first 24 hours of life, the tiny amounts of breast milk that infants need, it's so small. Their stomach is on average about the size of a small marble in those first hours. And they typically take 5 to 7 mLs, or roughly a teaspoon of colostrum per feeding session, which adds up to only about 1 to 2 ounces or 30 to 60 mLs of the entire first day. When we think about the size of the bottles that we use in newborn nurseries, it doesn't make a lot of sense biologically anyway. So it's so important to allow frequent unrestricted feedings to help establish breastfeeding and encourage milk production. Frequent skin-to-skin contact also helps with this process. Every baby is different, so feeding cues such as rooting or sucking on hands should be followed rather than strictly adhering to a schedule, even in the hospital, or especially in the hospital. In the first days, my favorite mantra is, when in doubt, feed the baby, in order to have small, frequent feedings that help bring milk in and support a newborn's blood sugar balance and hydration. You know, we talk about skin to skin as it's something that just has to be done when the baby's born. And I like to encourage skin to skin anytime, as much as possible during those first few months. And as a matter of fact, when families come to my office, we typically, if parent is up to it, start out with skin to skin as we're chatting and let the baby just be close to mom and on the skin. And we let the baby root to the breast. And sometimes my work is done for me that way. It's pretty amazing. Baby just latches and does so much better with mom not worried about trying to latch baby on and let the baby come to her. It's beautiful. Okay, so number 4, we have eight topics, and this is number 4 of the things that I wish all medical professionals understood about breastfeeding. And we got all the way to number 4 before we mentioned tongue tie. So number 4 I have selected is that tongue tie and other oral restrictions can significantly impact breastfeeding. I want everyone to know that oral anatomy, particularly tongue and lip ties, can prevent effective latch and milk transfer. It's important for medical professionals to recognize the signs of tongue tie: poor latch, slow weight gain, clicking sounds during feeding, prolonged feeding, and especially painful feedings. Early assessment and referrals to lactation consultants can make all the difference when any of these symptoms occur. Lactation consultants also want medical professionals to be informed about the debate surrounding tongue tie treatment and offer holistic support rather than just a quick snip or even a laser release. Number 5, we're going quickly down our 8 points here. 8 points that I want all medical professionals to know. Number 5 is understanding milk supply, how it all works. Milk supply is primarily driven by supply and demand, or sometimes I reverse it and say demand and supply. The more the baby nurses, the more milk is produced, or the more milk that's removed from the breast, whether by nursing or pumping, the more milk that breast cells will make. So empty cells in the breast are the factories for milk production. When they're full, the impetus to make more milk does not stick around very long and the milk supply goes down. So our bodies know to make enough milk. And how do they know what the baby needs? Breast cells know what to make based on what is removed. It's a pretty fascinating, awe-inspiring system, if you ask me, how this all works. I'm a bio nerd. I love this stuff. But bottom line is early and frequent breastfeeding sessions, especially in the first few days, help establish an adequate milk supply. I remember learning early on that, and this is probably about 20 years ago, that the milk removed in the first few days, even the first 24 hours, affects the milk supply at 6 weeks. Pretty amazing, right? For this reason, medical professionals need to avoid recommending early supplementation unless absolutely necessary, as it can interfere with milk production. So if a baby gets a bottle and gets filled up for a long time because there's a lot in the bottle, it comes quickly, and formula is, I'll use the term, heavier than colostrum or early breast milk, then the baby's not going to have the impetus to feed, and the breasts aren't getting that message to make milk. So if it's medically necessary for the baby to be supplemented, the first choice, according to the American Academy of Pediatrics, is mother's own milk. If that isn't possible or it's not available, hand expression or pumping should be initiated as soon as possible to protect and build maternal supply. Lactation consultants often encounter parents who worry about their supply. It's actually one of the chief reasons given for giving up breastfeeding completely. Reassurance and education on the process can reduce anxiety and build confidence. And again, if you're not the one to give the education and assurance, please refer to someone who can. We can't all be expected to know everything about every topic, right? So we have referral partners, we have networks that we reach out to for this reason. Okay, we're up to number 6 of the facts that I wish that all medical professionals knew about breastfeeding. Medical safety during breastfeeding. Oh my goodness, this is really a pet peeve of mine. Many parents are told to stop breastfeeding when they are prescribed medications or have radiology testing or even dental work. But in most cases, this is completely unnecessary. Did you know that for most medications, the safety is higher for breastfeeding than during pregnancy? We are very quick to prescribe during pregnancy, but we're afraid to give common medications to a breastfeeding mom. Of course, as with everything, I feel that less is more. And as far as over-the-counter and prescription medications, we should always avoid them if we can. But when needed, a risk versus benefit approach should be implemented. Lactation consultants like me wish that more medical professionals were familiar with resources that give the real information about medications in mother's milk, such as LactMed, which is LACTMED. That's a National Institute for Health site, and the Infant Risk Center. And you can Google them, they come up easy. And they provide accurate, up-to-date information on medication safety for breastfeeding mothers. The majority of common medications are compatible with breastfeeding or have alternatives. Many healthcare professionals fail to understand how breastfeeding works with regards to pausing breastfeeding for a medical treatment or medication. Breasts don't have an on-off switch. Abruptly stopping breastfeeding can lead to complications like engorgement, mastitis, and a drop in supply. So careful consideration is needed before advising moms to wean, even temporarily. I have had situations where parents are casually told, oh, just stop for a few days, or, well, this is only for a week or two. And that really interferes with the breastfeeding relationship and can cause problems. Okay, we're up to number 7. Breastfeeding affects both the baby's and mother's long-term health. Breastfeeding offers significant health benefits for both mother and baby beyond just nutrition. Babies who are breastfed have lower rates of infections, SIDS, allergies, asthma, and obesity. For mothers, breastfeeding reduces the risk of breast and ovarian cancer, type 2 diabetes, and cardiovascular disease. Isn't that amazing? And the reason for that, again, being the bio nerd that I am, is that the changes that are made to support breastfeeding in the mom after birth are things like increased cholesterol that needs to be used, and glucose metabolism, which changes. And these changes are all made expecting the mother to breastfeed on a physiological point of view. It's not not an expectation that's just for society. It's for physiology. And when a mother does not breastfeed after a pregnancy, she runs these higher health risks. So it's pretty amazing. And more medical professionals need to understand this and communicate these long-term health benefits, counseling families about infant feeding choices. The other benefit to breastfeeding in the infant, which is near and dear to my heart, is airway health. And I have other episodes on this topic, and I'll be diving into that topic on other episodes too, but just didn't want to not mention it here. Okay, and number 8 is supportive language and attitude matter. As with everything, the way medical professionals speak to parents about breastfeeding can significantly influence their experience and confidence. Avoid language that suggests breastfeeding is optional or not worth trying. Instead, be encouraging, affirm a parent's efforts, and offer guidance and referrals to anticipate challenges and definitely when any challenges arise. Lactation consultants, like myself, stress the need for a collaborative approach. Medical professionals and lactation consultants working together to support parents in their breastfeeding journey. Thank you so much for listening to the Tongue Tie Experts podcast today. We've covered some key insights into what lactation consultants want all medical professionals to know about breastfeeding. If you're a healthcare provider, I encourage you to incorporate these points in your practice to better support families in your care. If you are a lactation consultant and you have more ideas to share with me, feel free to reach out. You can email me or send me an Instagram message. I'd love to hear from you. Don't forget, subscribe to the podcast for more discussions on breastfeeding, tongue ties, and thank you so much.
Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Paladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.